What is the philosophy of naturopathic care?
Naturopathic care governs or operates under the philosophy of 6 principles. 5 principles, some want to add a 6, but the first principle is treat the whole person. People need to be treated with respect and dignity, and they are more than just a kidney or more than just, a lung or a heart. They're a whole person. And so we look at all the systems interacting in their body as well as them interacting in the world. How are their relationships? What is the stressors in their life? And how are the various systems in their body operating? So we look at the whole person. Next one is called the Vis Medicatrix Naturae, which is Latin for the healing power of nature. And what this refers to is not so much the healing power of, say, herbs or things that grow in the ground, but more so it recognizes the innate process within each of us toward healing. When you get a cut in your arm, it, for most people, usually heals up. You don't have to think about it. There's nothing you really do. It just kind of does it. It's a process that's built into your system. And so the idea is, for the naturopathic doctor, is to assist that process. Or if that process isn't working very well, figure out what is the cause that's inhibiting that process, remove that cause, and assist that process. So the next one is treat the cause. Really look for the underlying causes. And there are always various levels of cause. So we try to really get at the root cause of conditions. The next one would be the principle called docere, which is Latin for doctor. And the original term docere means teacher. So the principle is doctor as teacher. We teach our patients healthy principles that they can apply their whole lives. We teach them to help themselves, to heal themselves. That principle also involves the healing potential of the relationship between the doctor and the patient. It seems to be that there is a healing potential there, and there's also, on the other side, a potential for a negative effect as well. How I interact with my patients can directly affect how well they get better. How much confidence I have in them, how positive I am with them, all affects that. The next principle is prevention. It's easier to prevent illness than it is to cure illness. And so we promote healthy lifestyles to prevent illness. So you can see, looking at all these principles here, that the main idea is health promotion rather than disease destruction. Rather than removing a disease or blocking it, we're trying to promote health for the natural processes in the body that are oriented toward health to help the person overcome their illness.
So you help them to heal themselves.
Yeah, that's true. And as far as assessment and treatment goes, the assessment side of things, we kind of look at the determinants of health. What are their inborn things that are determining their health? What's their genetic makeup? What was life like for them while in their mother's womb? That can affect their health. What is their environmental situation? What sort of toxins in the air are they exposed to? What sort of food are they eating? That kind of thing. What are their relationships like in their life? How much sun exposure do they get? How's their digestion? All that. So what are the things determining their health? What are the potential causes affecting their health? Looking at that. And then as far as the treatment goes, we operate under a therapeutic order. So first would be establish the basis for health. It's hard to be healthy if you're not eating. It's hard to be healthy if you don't get adequate water. It's hard to be healthy if you don't have any meaning or purpose to live. So you have to establish first the basis of health: good nutrition, good relationships, good mental attitude. And then next on down that would be support that innate process I was talking about, support that healing natural process. Next down would be support weakened systems. So trying to identify which systems aren't working optimally. If a person's not digesting and absorbing well, they're not getting the nutrition they need for the body to do what it needs to do. So we try to identify weakened systems and support that. The next, you also want to make sure structurally everything is in alignment. And this would be, similar, I suppose, to what a chiropractor would do. look for any bones out of alignment, and it's good to be in alignment for you to have optimal health. And then finally now we get to specific things for specific conditions.
Okay.
So you can see through this whole thing, we're looking at the whole person, we're promoting health.
Mm-hmm.
But yes, there are times when you need specific herbs for specific conditions, and that's where research really helps us out. Finally, there's medications and surgery. So we're not opposed to medications, we're not opposed to surgery, we're not opposed to conventional medicine, but we just don't always use that first unless, again, the situation is emergent.
Mm-hmm.
If there's maybe a reason to jump to the bottom of that therapeutic order, but in general, we try to go, establish the basis for health,
Right.
strengthen weakened systems, and then use natural, safe things like herbs and nutrition for specific conditions, and if necessary, medication.
Thank you for that insight.
Thank you.